Every year, the experts at U.S. News & World Report rank the nation's best hospitals. They've recognized St. Vincent as the #1 hospital in Arkansas and listed 8 clinical areas as high-performing specialties. The next closest Arkansas hospital only had 3. This recognition is due to the unwavering commitment of our world-class physicians, dedicated nurses, and associates who have now made St. Vincent the state's #1 hospital.
Welcome back. Dr. Bushra Shah joins us again today from the Longevity Center at St. Vincent, talking today about heartburn, which, I don't know, just about everybody may get this at some point in their life, whether it's a lot or just a little bit. Has nothing to do with your heart, though, really?
No, it doesn't. Heartburn is really a symptom of your digestive tract. It is the most common symptom experienced with a condition called Gerd, or gastroesophageal reflux disease. Your heart is in your chest on the left side, and your esophagus, your food pipe, runs right in the middle of your chest, right behind this big flat bone called the sternum. The esophagus connects to the stomach. There is an opening between the esophagus and the stomach, and when this opening is weak or it's loose, it allows the acid in the stomach to regurgitate back up into the esophagus, which is called acid reflux. When the acidic juice from the stomach goes up into the esophagus, it irritates the esophagus, and hence we get the symptom of heartburn.
Because it feels sort of like a burn.
Absolutely.
In that area. Let's talk about some ways that we can avoid it or at least lessen the effects. And first of all, smoking is #1 on the list.
Yes, if you're a smoker and you experience heartburn, only thing you can do is stop smoking. And then there's certain beverages also, all the stuff we like, coffee, even decaffeinated coffee contributes to heartburn. Alcohol, carbonated drinks, citrus juices, those with high acid content.
Orange juices.
That's right. And then there's certain foods, tomato and tomato containing foods, spicy foods, fatty foods, even onions, and chocolate, mints and peppermints. All these foods tend to increase the acid production in your stomach, and we want less acid, so there's less acid regurgitating back into the esophagus.
A lot of people kind of get to know what gives them a heartburn. They're like, oh, I can't eat that, it gives me heartburn. So those are the things to avoid. You also have aspirin and ibuprofen on the list,
yes, those are 2 common medications that we take for joint pains and aches, and aspirin is used very commonly, and if you have had prior peptic ulcer disease or you're at risk of developing an ulcer, you should not take aspirin or ibuprofen. Again, it increases the acid and hence the reflux.
If those people have a headache or a joint pain, what can they take? Tylenol's better.
Tylenol's a better option.
And not linked to heartburn.
No.
Okay, let's talk about when symptoms get worse, because you've said if you just get heartburn every once in a while, that's not necessarily that bad.
No. Mild heartburn is almost physiological. Everybody experiences heartburn at some point. But if your symptoms persist, they can cause difficulty in swallowing, because the acid constantly bathes the esophagus, and it can irritate the lining of the esophagus and cause inflammation in that area, which is called esophagitis. And it can even cause bleeding if it erodes the lining of the esophagus. And those are just some of the problems that can develop with symptoms getting worse.
Some of the symptoms from that are vomiting blood, stools being dark and bloody.
If your symptoms are getting worse, you're having heartburn more than 3 times a week, you need to seek medical attention. And some of the symptoms that you need to look out for is pain on swallowing or difficulty swallowing. Again, that's from the narrowing that can develop in your esophagus, vomiting blood, blood in your stools, dark tarry stools, shortness, dizziness, lightheadedness, or even back and neck pain associated with heartburn.
Really? I didn't realize that. Is there a surgery that can be done to fix that?
Yes, there is, because what you're trying to repair is the opening between the esophagus and the stomach, so that it's tight and the stomach doesn't regurgitate back the acid. There's an incisionless surgery that's done at St. Vincent by the doctors at St. Vincent to repair this problem.
Yeah, hopefully it never gets to that point. You can treat it otherwise, but perhaps if it is bad, you can check into that surgery.
There are over-the-counter medications. Everybody's heard of Zantac and ranitidine, Tums, that, you know, pregnant women use a lot because pregnancy is a condition that, you know, you can experience heartburn. There's increased abdominal pressure from the growing fetus in the uterus,
right.
pushes it up, and even the pregnancy hormones can weaken that opening between the esophagus and the stomach. And then your doctor, you know, everybody's taken omeprazole and other proton pump inhibitors, other medications. So if the medications do not work, then surgery is the last resort, but there are medications. But avoiding precipitating factors is probably the best thing you can do.
Okay, very good. So now you know a little bit more about it. Like she said, most of us get it at some point, some worse than others though, so hopefully you know when you need to go see your doctor. Let's put up the information about the Longevity Center at St. Vincent. There it is. That's where Dr. Shah and a whole group of doctors are there to help you. Right here in Little Rock, 552-4777 if you have more questions or think you need to set up an appointment with one of their doctors on staff. Thank you, Dr. Shah.
Thank you.